Good morning, guys. Today we're gonna talk about microdosing. What is microdosing? Why do we microdose? What are the benefits? What are the potential risks of microdosing? Well, microdosing is using the minimum effective dose in the most effective way to achieve your desired outcome, which is stable male androgen levels. This should be the premise behind testosterone replacement therapy. I'll take it a step further and say we should look to maintain function and optimize male androgen levels. So when we talk about maintaining function, I am a massive advocate of daily testosterone cypionate injections and HCG injections. Why? Hormones follow a diurnal pattern. Testosterone is highest in the morning because anabolic processes predominate at nighttime. But hormones don't care what day it is, they want to be stable. Homeostasis is the principle by which your body maintains a constant internal environment despite external changes. Your hypopituitary gonadal axis is a self-regulating negative feedback mechanism whereby your body again responds to internal changes and external stimuli to provide you with the correct amount of testosterone, estrogen and dihydrotestosterone. We need to understand the premise is balance, and anabolic hormones have contrary catabolic hormones. Both are necessary. Anabolic for growth and repair, prepare for the next day. Catabolic for fight or flight, to go hunt, to go gather. Balance. You need contrast in order to establish balance. So when it comes to testosterone replacement therapy, we should be looking to achieve stable levels irrespective of what day it is you're injecting your testosterone and or HCG. The old school way of prescribing testosterone monotherapy was an injection once every 2 to 3 weeks. Now, presumably this was because of convenience stroke compliance. However, injecting 250 milligrams, irrespective of it being attached to an ester, and expecting it to achieve stable levels from Monday through Sunday, Sunday through Monday, is absurd. So, we moved to more frequent injections. I say we, I mean the Americans did. The British has a very regressive healthcare system. It's very safety conscious, but testosterone replacement therapy is not set up for health optimization. The NHS was founded on the principles of need, and this was after World War II when the country was in a dire state. Unfortunately, the healthcare system has not progressed to this preventative health optimization model that it wants to achieve but can't. It doesn't have the resources or actually the inclination. It might say, lose some weight, do some exercise, but there is a massive divide between medicine that is focused really on curative and keeping people out of hospital and preventative disease. Now, preventative disease is a massive health problem. Testosterone deficiency, there are numerous non-organic causes. Functional hypogonadism is rife within our society, and there is a silent epidemic. Unfortunately, the NHS does not have the capacity to deal with this. So even if it was to accept that your testosterone of 12 is not really adequate for a 18-year-old, it has to work within the confines set out by the CCGs, the Endocrine Society, etc. The computer says no. So we are fighting an uphill battle. I was recently refused entry to the Society for Endocrinology. Now that takes on board anybody who's got an interest in endocrinology, from doctors to medical students to researchers. I run the Men's Health Clinic. Our focus is addressing, diagnosing, treating testosterone deficiency and you really couldn't make it up. So there is unfortunately a divide between the NHS and the private sector. Now most private clinics and companies do not prescribe as per the manufacturer guidelines because they recognise that prescribing 250 milligrams every 2 to 3 weeks is an ineffective way of achieving stable levels. There are some very peculiar private practices out there that do prescribe as per the manufacturing guidelines. Perhaps you just get a nice cup of coffee when you walk into the establishment, and then they can justify their £300 consultation fee. You get a sympathetic shoulder to cry on. What we should be doing is moving with the times, moving with the research. I was going to say data, but that's American. Because a lot of the data does actually come from America, because they do have a far more progressive healthcare system. But what we've done is take that, combine it, blend it with the safety aspect of the British Society for Sexual Medicine guidelines, and made our own very own bespoke TRT protocol. Now you cannot have a one-size-fits-all methodology, but as a principle, gold standard TRT is daily subcutaneous testosterone cypionate injections and HCG. Let's talk about why that is the most effective way. Now, lots of other clinics do microdose, but they're not as aggressive as the Men's Health Clinic. Now, you can make an argument, if you have a normal to high SHBG, that less intensive injection frequencies will achieve stable levels. Now, we did adopt this injection frequency every 3.5 days, and we did achieve success with it. However, we noted guys with low SHBG were still not stable. They were having a roller coaster effect despite injections every 3.5 days. So we moved them to more frequent injection frequencies, every other day. And then we moved them to dailies. This is the most effective way of achieving stable levels, irrespective of SHBG. Now, SHBG is a glycoprotein produced by the liver that grabs hold of the testosterone. It grabs hold of it because testosterone, DHT and estrogen have really short half-lives. So you're not producing test constantly, so you do need it to bind to a buffer. So remember, the primary purpose behind TRT or testosterone is to help facilitate growth and repair. That's what this is about. It's also about feeling good, but the primary purpose of this anabolic hormone is anabolism. So when you think about the effects of testosterone on the body, if you have an unbalanced TRT protocol, it can cause side effects. What sort of side effects can it cause? DHT. Now, I'm not going to lie, we don't ever have problems with DHT because you never get an elevation in DHT compared to testosterone and estrogen. And it's more the ratios that are of significance when it comes to side effects. However, that's not 100% true, but we'll get to that in a minute. DHT. The one side effect that most people complain of with excess DHT is acne. That's why you see all the steroid boys in the gym walking in with their back knee, because most anabolic steroids are DHT derivatives. Prostate self-regulates its DHT. Male pattern baldness, it's genetic really. It can accelerate it a little bit, but only because you've actually normalized your DHT levels rather than artificially elevated them. Your testosterone. So what happens if you have too much testosterone? You can have an abnormal profile in your lipids. Me speak wrong way round. Your HDL can go down, and that's a protein that takes cholesterol away from the cells, and your LDL, which takes cholesterol to the cells, can go up. We don't want that. You can create too many red blood cells. Testosterone is anabolic, so it tells the kidneys to release erythropoietin, the same substance that Lance Armstrong and all his compatriots were injecting. Now this tells the bone marrow to produce red blood cells. We want red blood cells to carry oxygen to the tissues for one of its functions, and so for endurance athletes such as Lance Armstrong, this was great. So you can't have too much testosterone. Lance Armstrong's a perfect example. No, he's not a perfect example, because cyclists, endurance athletes, tend to have something called a sports anemia. This is, they produce more plasma than the average schmo. They do that because they need to carry waste products from the metabolism usage of their muscles away to the kidneys to be excreted. So Tour de France cyclists and endurance athletes can have or seek an advantage by artificially raising their hematocrits. Makes sense. So when this is used as an example, cyclists don't have problems with their hematocrit. Well, yeah, they do actually. The fittest people on the planet have problems. Why? Because they're naughty boys. Lance Armstrong tells a story about cyclists waking up at 3 o'clock in the morning and going for a quick bike ride because they were feeling the negative effects of HGT. High testosterone also makes you a bit of a dick. So we all know the bodybuilders, we all know people on the internet who have got high testosterone. They lack empathy, they lack insight, they lack objectivity. There's no point arguing with these fools because they're a bit pointless. With normal testosterone, you should be cool, calm and collected. Estrogen. Oh, let's not go over that again. I did that in the last video. But we are essentially wanting stable male androgen levels. Now, we've already discussed the fact that you don't necessarily need to go to an injection frequency of daily injections with a normal to high SHBG. Well, actually, through experience, even those guys feel better. High SHBG guys feel better with daily injections. Why is that? I'll tell you. It's because you are as close as, damn it, mimicking natural physiology. Now, you can achieve stable levels with less intensive injection frequencies because of SHBG, because of the ester attached to the testosterone. So when you inject testosterone, it has to go into the bloodstream, then to the liver, to have the carbon atoms cleaved to free up that testosterone, for it then to attach to SHBG, and then it get converted to DHT and estradiol, unless it's going to be used as testosterone. So in theory, you don't need to, but in practice, we have found that daily injections is far more suitable for everyone, and everybody that was stable on less intensive injection frequencies is now on daily injections, and they all, almost without exception, feel better. It's a bold statement to make, but I stand by it, honestly. So when you come to the men's health clinic, I will suggest, advise, recommend that the most effective way of not only achieving stable levels, but minimizing side effects and feeling great, is daily injections. The HCG is to help maintain function, because testosterone suppresses the hypothalamus and pituitary, so you no longer send LH down to the testicles. So the HCG is to maintain function of not only the testicles, so you produce some natural testosterone. Again, we want to help mimic, support physiology. There are also LH receptors in the brain, so guys do have an improvement, increase in libido and sense of well-being with HCG. It's always a balancing act, so you do need to be with somebody that knows their arse from their elbows, and there aren't many of them people around. And what we do is we supplement, top up, optimize with testosterone. So I have a standard starting dose for the HCG, and I tend to change my starting testosterone dose according to a number of parameters, including age, which is a major determining factor, type of hypogonadism, because obviously HCG will not produce a significant amount of testosterone if you have a primary picture. Again, speaking in generalities rather than rules. What you do have to do is you have to titrate the dose according to effect to find the optimal numbers for the person you are treating, and understand that physiology changes, physiology adapts, and so you cannot have a one-size-fits-all methodology to TRT, and you must work with the patient to help them achieve hormonal balance. And then with hormonal balance, which is the foundation from which to build upon, you can reverse the negative symptoms that you presented with. Testosterone is a misunderstood hormone. DHT, estradiol, there's miscommunication, misdirection, people wanting to make names for themselves. You must adopt a personalized, logical, common sense approach. So the daily injections. Oh no, daily injection, I don't want to pin myself every day. Man up, princess. What we do is we use 29 gauge insulin needles. It's essentially painless. It's just a small prick. And into the subcutaneous tissue, it's literally no pain. You might get a sting every once in a while, where you just pinch a nerve. You might get a blob of blood, a pin-sized blob of blood, but it's essentially painless. Oh, it's not convenient. I can't comply with daily injections. Do you brush your teeth every day? I hope so. Well, then you can pin every day. If a 6-year-old child can inject insulin multiple times a day, you can have a couple of little pricks in the morning. Honestly, it takes literally 2 seconds. So, sorry, just someone's come to the door. So it is. I've lost my train of thought now. Thought it was bloody takeaway crap. Yeah, what the hell was I saying? Yeah, every day, couple of little pricks. It is nothing. I actually prefer it because I don't actually have to think about it. I don't want you guys obsessing about testosterone replacement therapy. I want it just to become part of your life. So an actual benefit is daily injections removes that thought process. Is today my injection day? Oh no, it's tomorrow. Oh, I've missed it. If it becomes part of your daily routine, you are removing it from your conscious thought and it being a big thing. So from a compliance perspective, daily injections using a 29 gauge insulin needle into the subcutaneous tissue, man up, princess, if you can't do that. Microdosing. Microdosing is the future. We should move with the times. We should have a progressive approach to testosterone replacement therapy.